Hello friends, this is your favorite orthopedic surgeon Dr. Tejas. Today we are going to discuss about a very important topic because many people nowadays are facing it. And in my OPD, I get around 30 to 40 cases per week, and usually young adults and who are around the age of 50. See, the most common complaint they come to me is we have shoulder pain. We have not been injured. We have not been straining the shoulder too much. Still, there is some sort of restriction in the shoulder. Most common cause of shoulder pain and movement restriction when X-rays are normal, frozen shoulder. So, what is frozen shoulder? As many famous orthopedicians say, that thing which is difficult to detect, difficult to diagnose, and difficult to treat is frozen shoulder. Because there is some element of truth in it. Many people suffer, in spite of all treatments, they suffer with this frozen shoulder for as long as 20 years. What can we do to treat your frozen shoulder, and what can we do to avoid being affected by this frozen shoulder? What commonly happens is people who are stressed in the software field or in sports field, lots of stress, very little sleep, diabetic at a young age, having thyroid disorders and all. Suddenly their shoulders seem to get stuck in a position, especially if you are wearing a coat or something. Suddenly they get this pain and it becomes a lifelong pattern. What can we do to prevent this frozen shoulder? First thing is keep your sugar levels normal, because though 20% of the cases do not have any cause as such, but diabetics are 20 times more prone to get this frozen shoulder. So if you are a young adult doing a stressful job in a sedentary lifestyle, working on a system or computer, first thing you got to do is check your blood sugar levels regularly and keep them normal. Second thing is regular thyroid checkup, and always keep your thyroid hormones in range as well. These two factors we can eliminate about 70% of cases. Sometimes it may be secondary causes. You get pain suddenly while bowling. There is some wrong movement, and some people have some habitual movements by doing mannerisms. They dislocate their shoulder for show off and all doing these exercises. And in case of injury, the chance of shoulder after the injury gets healed, the chance of shoulder become frozen is very high. First thing what we do is we take an X-ray. Even though the most of times X-ray comes normal, we usually prescribe an X-ray because we want to rule out other joint pathology, fractures, dislocations, and other things. Once the X-ray is normal, we can safely diagnose it as frozen shoulder. There are three stages in the frozen shoulder. Onset phase. It lasts from 2 to 9 months. This phase, the shoulder is very painful compared to other. Movement is there, you can possibly move the shoulder, but it is very excruciatingly painful. One important thing to avoid in this phase is stop exercises that stretch the shoulder. You need to rest it as it demands. So enough rest must be there. You can go with conservative treatment like applying an ice pack or some ointment, some painkiller ointment, and keep your shoulder in a resting position, preferably in an immobilizer or something. And then comes the second stage, which can last for 2 to 3 years. Here, restriction of movement is there. I mean, you start experiencing some restriction in your free movements. At this phase, I mean, it's sort of a late detection. So, what do we do in this phase? Same. We do the same with eyes, rest, and topical application of painkiller, ointment, and all. Still, if the pain doesn't go away, what we do is we immediately take an ultrasound. In this phase, there is some capsular adhesions visible in the ultrasound. So we can give injections, steroid injections, or simple hydrodilation, local anesthetic with coupled with steroid and all. So these have shown, I mean, on my clinic, these have shown a fantastic result. Like 90% of cases have been cured, and the rest of the 10% are also because they are very old patient or repeated trauma, repeated injuries to the same, that relief may be little bit. And the third phase, there is complete stiffness. In the complete stiffness phase, this is the phase that lasts the longest, because you see people stop lifting their shoulder for the fear of pain, and gradually shoulder becomes restricted and becomes fixed in the position. So here what we do is we manipulate it under anesthesia, break any adhesions, and these adhesions can be broken with external manipulation under anesthesia, or Why arthroscopy or by injections? And around 45% cases injections with saline and anesthetic and steroid combination is enough to break the lesions. But post the, breaking the lesions, patient must strictly follow the physiotherapy regimen we prescribe. Most chronic cases, those which are resistant to treatment and all, what we do is arthroscopically we break the lesions and make the shoulder joint spacious enough for the shoulder to move and restore the normal function. So friends, you have learned about frozen shoulder now. Please share it with your family and friends who have any shoulder problem. So friends, this is today's topic. Hope you got some information from that and hope that it helps you. And if you have any queries, any doubts, please put it in the comment section. I'll make a video and respond to all of them in the next week.